science-based DRRM, Dr. Lagmay emphasizes the importance of using scientific data such as hazard maps, flood modeling, and geospatial analysis to inform disaster planning and response. This ensures that interventions are accurate and effective. Early warning systems. Technologies like flood forecasting and geohazard mapping are critical. These systems can predict events days in advance, allowing communities and local governments to prepare and evacuate if necessary. Community-centered approach. DRRM must be localized. Communities should be actively involved in identifying risks, planning responses, and implementing solutions. Empowering local stakeholders leads to more sustainable resilience. These are the key takeaways. First, disaster. A serious disruption of the functioning of a community or society involving widespread human, material, economic, or environmental losses and impacts. Next, hazard. A potentially damaging physical events, phenomenon, or human activity that may cause loss of life or injury. Third, exposure. The situation of people, infrastructure, housing, production, capacities, and other tangible human assets located in hazard-prone areas. Lastly, vulnerability. The conditions determined by physical, social, economic, and environmental factors which increase the susceptibility of a community to the impact of hazards. The four pillars of DRRM: prevention and mitigation, reducing the likelihood or impact of disasters. Next, preparedness, planning and preparing for an effective response. Third, response, immediate actions taken during and after a disaster. And lastly, rehabilitation and recovery, restoring and improving livelihoods and infrastructure post-disaster. In our community, the Las Piñas Zapote River Drive, a flood control project initiated by Senator Cynthia Villar, was intended to reduce flooding and clean the Zapote River. Despite its completion, flooding persists in nearby communities. Listed are the hazards and vulnerabilities that occurred during floods in our community. Identified hazards. Flooding occurs when the river overflows due to heavy rainfall or upstream water release. Low-lying areas near the river are especially prone, leading to property damage, displacement, and health risks. Concrete structures are short-sighted. Other experts like landscape architect Jose Dan Villajuan argue that concrete solutions often ignore the dynamic nature of the river systems. These structures can crack, collapse, and increase downstream flooding due to reduced absorption and intensified water flow. Waterborne diseases post-flood. Illnesses such as leptospirosis, cholera, and dengue may spread due to contaminated drinking water and poor sanitation after flooding. These outbreaks typically follow major floods. Cementing river banks reduces infiltration. The implementation of the River Drive project resulted in the cementing of the river banks of the Zapote River, where the retaining walls supposedly help in slope protection and prevent soil erosion. Dr. Francis Magbanwa, a freshwater scientist from UP Diliman, explains that natural soil plays a critical role in filtering water and contaminants before they reach the river. He warns that cemented surfaces eliminate this function. Infrastructure damage. Roads, bridges, and utilities near the river may be damaged or rendered inaccessible during floods, disrupting transportation, communication, and emergency response. Next are the vulnerabilities. First is the physical aspect. Poor constructed homes. Many houses near the river may be made of light materials, making them highly susceptible to flood damage. Lack of flood defenses. Absence of levees, dikes, or proper drainage systems increases exposure to rising water levels. Next are the social aspects. Limited disaster awareness. Residents may lack knowledge about flood risks, evacuation procedures, or early warning systems. Vulnerable populations. Children, elderly, and persons with disabilities may struggle to evacuate to recover from disasters. The economic aspect. Low-income households. Families may not afford to relocate, rebuild, or invest in protective measures like elevated housing. The environmental aspect. Poor waste management. Garbage clogging drainage systems worsens flooding and contaminates water sources. Government infrastructure, narrowing waterways. Projects like the River Drive, while intended to improve access or aesthetics, can unintentionally constrict the river's natural flow, reducing its capacity and causing water to overflow into nearby communities during heavy rains. Some of the tools used. UPNO's hazard maps show the communities near the Zapote River remain at medium to high flood risk, with depths ranging from knee to above neck level. The next are my DRRM strategy proposal. First is aligned with the prevention and mitigation. Reassess and redesign infrastructure projects, such as the river drives, ensures that government projects do not worsen flooding, promotes environmentally sound engineering that respects natural waterways. Preserving natural solid and vegetation for infiltration and filtration. Dr. Magbanwa emphasizes the need to preserve soil and vegetation along riverbanks since this reduces the likelihood and severity of flooding by allowing water to be absorbed naturally, minimizing runoff and contamination. Next pillar is the preparedness. Community-based flood monitoring trains locals to observe river levels and report early signs of flooding. Localized education campaigns uses barangay assemblies, schools, and social media to teach residents about flood risks, evacuation routes, and first aid. Third, response. Mobile rescue and medical units. Deploys trained teams with boats and emergency supplies to reach flooded areas quickly and safely. Real-time communication systems. Uses SMS alerts, radios, and social media to disseminate warnings and instructions during disasters. Lastly, rehabilitation and recovery. Post-disaster livelihood programs. Supports affected families with job training, financial aid, and tools to rebuild income sources. Advocating for nature-based solutions and allowing rivers to follow their natural course. Villajuan advocates for allowing rivers to follow their natural course, emphasizing that rain, erosion, and flooding are inherent and must be managed, not blocked. Supports ecological restoration after disasters and promotes resilient ecosystems that can recover and adapt over time. As future healthcare educators and community advocates, we have the power to shape not just the responses, but mindsets. By integrating science, local knowledge, and nature-based solutions, we can build a safer, more resilient community for a future where preparedness is a shared responsibility.